Imagine you're in a meeting, a typical Tuesday morning, nothing special. You're sitting there and someone across the table starts to look off. They're not clutching their chest and falling out of their chair. They're not gasping. They're just quiet, a little pale. Maybe they're rubbing their jaw. Maybe they're trying to discreetly loosen their collar. You look at them. They look back, and they give you that little wave that says, "I'm fine, just a long night." In that moment, you have two paths in front of you. One path leads to a full recovery and a return to the garden. The other path leads to a lifetime of managing heart failure, of getting winded on the way to the mailbox. And the difference between those two paths? It's not your genes. It's not how close you live to a hospital. The difference is what happens in the next 10 minutes. Forget everything you've seen on a screen. The heart attack in the movies is a weapon used for drama. The real heart attack is silent, it's subtle, and it is incredibly dangerous precisely because it doesn't look like the movies. This is the problem. We're all waiting for the classic movie heart attack. The clutching of the chest, the dramatic, "Oh my God!" and the collapse. We're waiting for a spectacle. But what happens when a heart attack doesn't announce itself with a marching band? It starts with something you might easily dismiss. A heavy fullness. Maybe you think you're just really tired. You might tell yourself it's just heartburn. The antacid you take does nothing, but you decide to give it a few more minutes. You have a meeting. You have things to do. You don't want to make a fuss. This is the most dangerous single decision you will ever make. And it happens all the time. People have spent hours waiting for a heart attack to look like it does on TV. Those hours aren't just wasted. Those hours are costing you your heart muscle. Here's the biology. Time is muscle. Your heart is a muscle, and like any muscle, it needs a steady supply of oxygen-rich blood. It has its own little network of pipes on its surface called coronary arteries. A heart attack happens when one of those pipes gets sealed shut, usually by a clot. The second that pipe is shut, the muscle downstream starts to starve. It doesn't complain politely. It begins to die. And the vast majority of that death is permanent. That muscle is gone. You don't get it back next month. You don't get it back ever. So a heart attack is a race against time. It is a race to reopen that artery. The question is, how much of your heart can you save in the chaos of the moment? It turns out there are exactly 3 moves you can make to buy time, protect your heart, and slow down the damage. They are decisive, they are simple, and they are proven. But you need to know what they are before the panic sets in. Because the day this actually happens, you are not going to have time to look it up. You will do what you already know, or you will freeze. So, let's get you ready. First, let's change how we think about the warning signs. If you are experiencing something in your chest, your upper body, or your breathing, and it feels wrong in a way that you can't explain, you need to treat it as your heart until a trained professional tells you otherwise. I want to introduce you to the concept of something I call the unmistakable subtlety. The classic signs are pressure, tightness, a squeezing or a heaviness in the center of the chest. But it's not always a sharp pain. It can feel like a band cinched around your chest or a weight pressing down. This discomfort can move up into your jaw, your neck, down your left arm, or even into your upper stomach. That's why so many people swear it's just heartburn. Along with this, you might experience a cold sweat that doesn't make sense for your environment. You might feel short of breath, nauseous, lightheaded, or just a wave of exhaustion that seems to come out of nowhere. And I need to be direct with you about something that is often missed. For women, heart attacks are more likely to be the quiet kind. The shortness of breath, the nausea, the pain in the jaw or back, or just a profound, bone-deep fatigue can be the primary symptoms, without the obvious chest grab. For people with diabetes, nerve damage can completely dull the warning pain, making the attack almost silent. Over the years, I have seen far too many people, especially women, who waited because what they felt didn't match the picture in their head. If you are with someone and they pass out, or become unresponsive and are not breathing normally, that is no longer a heart attack. That is cardiac arrest. The heart has stopped pumping. This is a different emergency, but you are their single best chance of survival. It comes down to 2 steps, and you don't need any training to do them. First, call 911 and put it on speaker. Second, start pushing. This is hands-only CPR. Place the heel of one hand in the center of their chest. Place your other hand on top. Lock your elbows and push down hard and fast at a rate of about 2 pushes every second. Do not stop. You are doing the pumping that their heart cannot. This can double or even triple their chance of survival. If there's an automated defibrillator nearby, send someone to get it. It will talk you through every step. In cardiac arrest, the only wrong move is doing nothing. Now, let's get back to the conscious heart attack and the 3 techniques. These are your specific moves, your action plan. Technique number 1. Make the call. The most critical move is the first one, and you have to make it the right way. Call 911 immediately. Do not wait. Do not drive yourself to the hospital. When you drive yourself, you are making one emergency into 2. If you lose consciousness behind the wheel, you are in traffic with no equipment and no trained hands. When you call an ambulance, your treatment doesn't start at the hospital. It starts the moment the paramedics arrive at your door. They can put an ECG on your chest, confirm the heart attack, and radio ahead. The hospital team will be gowned up and waiting. This shaves off those precious, life-saving minutes. When you make the call, say the exact phrase, "I think I am having a heart attack." Those words are powerful. They tell the dispatcher to send the right team and to start coaching you through the next steps. There are 2 mistakes people make with this call. The first is simply waiting, telling yourself you'll give it a few more minutes. Let me take that worry away from you right now. Paramedics would rather come out for a false alarm than arrive too late. The second mistake is driving yourself. So, the move. Sit down, call 911, say the words clearly, and stay on the line. Technique number 2. Chew the aspirin. If you have it, and you are able, chew 1 regular-strength aspirin. This is 325 milligrams, or 4 of the low-dose 81 milligram baby aspirins. You chew it to get it into your bloodstream fast. You don't swallow it whole. Why aspirin? Remember that clot that is sealing your artery? It's not finished. It's still growing. Aspirin makes your platelets less sticky, slowing the growth of the clot. It buys you time. This is backed by massive clinical evidence. A single dose of aspirin can cut the risk of dying by about 23%. However, you must be cautious. Do not take it if you are allergic, or if you have a bleeding disorder, an active stomach ulcer, or if you are already on prescription blood thinners. If you are not sure, the dispatcher will guide you. And hear this clearly. Aspirin is the second technique. It is not the first. It is never a substitute for the call. Chewing aspirin and then lying down to see if it works on its own is a deadly mistake. Technique number 3. Stop everything. This is the act of surrender, but the right kind of surrender. Stop everything you are doing. Sit down. Bring your body as calm and still as you possibly can. Think about what is happening. A piece of your heart muscle is starving. The moment you move around, get agitated, or panic, your heart demands more oxygen. It beats harder and faster. But the supply line is blocked. That extra work is work it simply cannot pay for, and that unpaid bill means more muscle damage and a higher risk of a fatal rhythm. So, your one job is to bring the demand down. If you are very short of breath, sitting up tends to be easier than lying flat. Loosen anything tight around your neck or your waist. Work on your breathing, slow and steady, in through the nose and out slowly. I know that's difficult when you are scared, but that adrenaline from panic drives your heart rate and blood pressure up at the worst possible moment. A crucial step. If you are alone, get yourself to the front door, unlock it, and then sit down nearby. That way, the paramedics can get to you even if you can't get up to let them in. This one small step is often forgotten. Now, there's a dangerous myth that has circulated for years about cough CPR. The idea is that if you feel a heart attack coming on while you are alone, you should cough hard to keep yourself going. This is false. It does not work. Forgetting this and picking up the phone can cost you the exact time that actually saves your life. So, the real third technique is simple. Stop moving. Sit down, breathe slow, and let the help come to you. I want to tell you about 2 people to show you how powerful this plan is. There was a man I'll call Howard. He was 66 and retired. He woke up one morning with a heavy feeling in his chest. He told himself it was heartburn. He didn't want to make a fuss. He sat in his recliner to wait it out. By the time he got to the hospital, 3 hours had passed. He lived, but he lost a large piece of his heart muscle. His retirement now is spent managing heart failure, getting winded just walking to the mailbox. Then there is a woman I'll call Lorraine. She was 64 and had almost the exact same morning. The same heavy pressure, a little nausea, an ache in her jaw. But Lorraine had learned the plan. She didn't wait. She told her husband to call 911. She said the words, "heart attack." While he was on the phone, the dispatcher had her chew an aspirin. She sat down in her kitchen chair, reached over and unlocked the back door, and slowed her breathing. The paramedics were there in 6 minutes. They had her artery reopened well inside that critical window. She walked out of the hospital a few days later. The last time I saw her, she was back out in her garden. That is the difference. The difference between a life lived and a life spent winded. The difference between a garden and a mailbox. It is the first 10 minutes. You cannot choose your genetics, and you can't undo 30 years of cholesterol overnight. But the first 10 minutes belong entirely to you. That is where you decide your fate. That is the power you have right now, tonight. So tonight, before you go to bed, do a few small things. Keep a bottle of regular aspirin somewhere you and your spouse could find it in the dark in 10 seconds. Make sure your house number is visible from the street. If you have a heart condition, know where your records and medication list are. Most importantly, have the conversation. Talk about these warning signs and this plan. Here's the plan in order for you to remember. 1. Call 911 right away. Say the words, "I think I am having a heart attack." Do not wait to see if it passes. Never drive yourself. 2. While you wait, if you have aspirin and no reason you cannot take it, chew one regular 325 milligram tablet or 4 baby aspirins. Let the dispatcher guide you. 3. Stop everything. Sit down. Loosen any tight clothing. Unlock your door. Slow your breathing right down to take the load off your heart. And if the person collapses and is not breathing normally, that is cardiac arrest. Call 911, put it on speaker, and start hands-only CPR, hard and fast in the center of the chest until help arrives. Use an AED if one is anywhere nearby. This is your plan. It is not vague advice. It is not a list of things to consider. It is a specific, ordered set of actions that can save your life or the life of the person sitting right next to you. You didn't wake up today expecting to need this, but that's the point. The heart attack doesn't care about your schedule. It doesn't care if you have a meeting. It doesn't care if you don't want to be a bother. It only cares about the clot, the time, and the muscle. The day this actually happens, the day you feel that pressure or that jaw ache, you will know exactly what to do. You will have already decided. You won't wait. You won't freeze. You will act. That is the power of preparation. That is how you reclaim the first 10 minutes. And that is how you get to walk out of the hospital and back to the things that matter.